Okay, so this section is going to be about IUDs. IUD stands for intrauterine device. It's a small T-shaped device that's inserted through the cervix. The strings protrude from the cervix to allow for the woman to check them for placement. So let's look at this IUD. It's actually a lot smaller than most people think it would be. Sorry, give me just a second. I've got to find the right screen. Okay, so here is the actual size and shape. This is an actual IUD. The cervix does have to be dilated slightly for placement, and most women do find placement relatively painful. There is some move now, or there's some movement now toward giving better pain management during placement of an IUD. It's brief, but it can be somewhat painful to place. It provides contraception for several years, and as long as pregnancy is ruled out, it can remain in, or it can be placed anytime during the cycle. There are different types. The copper T or Paragard is made from copper. Copper is spermicidal. It inflames the endometrium, and it prevents fertilization because it has the spermicidal effect. It also would probably interfere with implantation should fertilization occur, but it primarily works by preventing fertilization. The person usually continues to have normal menses because it doesn't interfere with ovulation. The risk, it needs to be placed by a provider, or risk and drawbacks. It needs to be placed by a provider. Sometimes women find that they're allergic to copper, so they have increased inflammation. IUDs tend to cause increased bleeding and cramping, infection. They can migrate. They can end up not in the right place. If pregnancy occurs, it can cause complications with the pregnancy and should be removed if possible. It's not always possible to do that. Failure rate with perfect use is 0.6%, with typical use is 0.8%. Again, these are estimates and these change from year to year, so sometimes it varies from the new update, but it's pretty consistently effective. The difference between typical and perfect use is going to be checking the strings to make sure it hasn't migrated. Mirena or levonorgestrel, Mirena is the trade name, is a different type of IUD. It's the same shape. That's actually the one we looked at. It impairs sperm motility, irritates the endometrium, and decreases the likelihood of ovulation. So it decreases the frequency of ovulation. It also prevents fertilization. It needs to be placed by a provider. It can cause bleeding and cramping, infection. It can migrate. Again, any IUD can cause complications if a pregnancy does occur, so it should be removed if possible. And the failure rate for the hormonal IUD is 0.1%. Okay, so the next piece we're going to talk about is permanent birth control, permanent fertility, end of fertility.